Hi, Brother Emmanuel.
Hello, Sister Blessing.
How are you doing? I'm happy to have you once again.
Yeah, same here.
Today I want to talk about musculoskeletal disease and disorder. Without wasting much of your time, it seems you are in the chapel. I will do it
Sure.
quickly. Let me
Okay.
share the screen with you so that we can move faster. Okay. Can you see the screen?
Yeah, I can see the screen.
Okay. Oh, sorry. This is another lesson. Please hold on a little bit. Okay. So today we'll be talking about musculoskeletal disease and disorder. So now if you want to ask me, I would say musculoskeletal disease and disorder comprises of diverse condition of um disease affecting bones, joints, and muscles, and also connective tissue. So now you can see the symptom of this musculoskeletal disease. It has to do with pain, tenderness, and swelling, malaise, weakness, fatigue, fever, obvious bone deformation, inflammation, stiffness, weight, and height loss. So these are the symptoms of musculoskeletal disease and disorder. Okay, as I'm scrolling down, you will see how this thing affect the bones and weakens the bone. So today I will talking about three particular diseases I choose. Those are the ones I wrote case studies on. So I would love to share it with you. And some of these diseases I believe you have, or maybe you've heard about it before.
Yeah.
You can see the pictures. Those are some of the diseases. You can see how it can damage the bone. This one is fracture, dislocation. You see how it can um affect someone's hand. Okay. So today I will be talking about rheumatoid arthritis. Have you heard about it before? The disease. Ready, Manuel?
Yes.
Okay. So rheumatoid arthritis is one of the chronic disease, inflammatory disease, okay, affecting the synovial membranes of the multiple joints. Let me show you the picture of it. You can see it. You can see how it disfigures somebody's hand. It disfigures people.
Okay.
I normally see this in aged people. Okay, older people like an old woman or old man. You see their arms will look like this. So you can see this is a musculoskeletal disease. Okay.
Okay.
So let's look at the symptoms, the signs and symptoms, and the diagnosis, procedure, and treatment. You can see from here the signs and symptoms talks about insidious development, malaise, low-grade fever, fatigue, weight loss, joint pains. And this is what they normally suffer from. When you see an elderly people talking about maybe pains in their joints or the arms, you should know that this thing is not normal. That is musculoskeletal disease called rheumatoid arthritis. So the diagnosis procedure is positive rheumatoid factor blood test. Is
So they
diagnosing
have to go through blood tests.
yes, it's a diagnosis that can be conducted during the this thing, when the person is brought to the hospital. These are what can be done to help the person, like to diagnose the problem, the disease. And the treatment plan, you can see, talks about the objectives are to reduce inflammation and pain, okay, to preserve joint function and prevent joint deformity. So you use this pain relief. This NSAIDs is a pain relief, okay? It's a non-steroidal anti-inflammatory drugs. It's a medicine for relieving of pains and inflammatory. So those are the drugs that can be used to reduce the pain. The doctor will prescribe the drugs to the patient, okay, to help the patient relieve the fever also. I don't know if you have any question or any contribution.
What really attracts or causes this kind of infection?
You say?
What cause or attracts this type of infection or disease?
Oh, like I said before, it is caused by inflammation.
Okay, I've
You
seen it.
get it? It's an
Yeah,
inflammatory disease.
I've seen it.
Okay, thank you very much.
Okay, move on.
All right. So another thing I want to discuss about is the cut. You see this? This particular
Yeah,
this particular disease affects the big toe. It swollen the big toe. Okay, it's a chronic disorder of uric acid metabolism. So it affects the big toe and it's very painful. Okay, it comes with excruciating pain. Like if you have it, you won't be able to wear shoe. You'll be wearing slippers. Even with that, you still experience some pain, and it usually affects the joints, like the big toe joints. Let me go down to the picture. You can see now. See, the big toe is swollen, and it
yeah,
shows the swollen and the inflamed joint inside. Okay, so the diagnosis procedure is that the identification of urate crystal in joint fluid or presence of tophi in around the joint. The tophi is the guts I'm talking about. Okay. So the treatment plan is bed rest. You just need to rest and immobilization of affected parts. Local applications of heat and cold, like using ice block or cold or hot water to, press the place to, reduce the pain, or analgesic drugs. Analgesic drugs and the non-steroidal, this is anti-inflammatory drugs, they are pain reliefs. I don't know if you understand what I'm saying.
yeah, I do.
Okay, so those drugs are pain relief. It will help you relieve some pains. Okay, so Brother Manuel,
Yes.
did you understand what I've talked about the guts?
No, this one is very clear and simple to understand. So I get the message.
Okay, so if you see somebody that's having this kind of disease, you'll be able to detect that this is a musculoskeletal disease, and his name is GAT. At least you
Oh,
know how to go about the treatment. You tell the person this is what you supposed to do. Did you massage it with hot water or cold water? Do you take pain reliefs, this and that? So we move to the last topic of today, which is fib okay, fibromyalgia. Have you heard of it before?
fibromyalgia, I don't think so.
You don't think so? But it's a common musculoskeletal disease. If I show you the picture, you'll be able to, recall it, or maybe you'll be able to know the disease I'm going to talk about. Okay, it's a chronic condition characterized by pain in muscle, ligaments, and tendons. Let me show you the picture so that you'll be able to know. You can see the red dots. Those are
Yeah.
the joints, the muscle, like, let me say, body pains. That's how some people describe it. I'm having body pains. Okay. It is musculoskeletal disease. Okay. So now the signs and symptoms is constant dull muscle ache, tender point or site where faint pressure causes an increase in pain, exhaustion, and depression. So this particular one can cause depression. And the diagnosis procedure has to do with a physical examination showing the widespread pain lasting at least 3 months.
Hmm.
And the treatment plan, the first goal is to reduction of pain, which is you can use pain reliefs. Okay. The second goal is improvement of sleep. This one I normally encourage my friend wherever he tells me about I'm having body pain, this and that. I will tell the person just get a nice rest, just sleep that sleep out. That's when you recover yourself. And even me myself, I've experienced it. If I have body pain, if I can sleep deeply before I wake up, I won't experience that pains again. And you can see the same antidepressants and anti-seizure drugs, stress management, and physical therapy. Okay, so these are the things that can help you relieve this body aches, this constant body aches. It affects the ligaments, the muscle, and tendon. And you can see and you can know that if you experience all these pains, you will not be able to go about your day. You will not be able to do your normal work or your normal house chores. It can even affect your work because you will not be able to, feel comfortable at your place of work. You will feeling body pains and a whole lot of that. So, but Emmanuel, I don't know if you have any concern or any question you
Not
would like
really.
us to
I
discuss.
No question. I understand.
Okay, so I
Actually,
think,
these ones are they are common. They are very common and simple. Just that the name
yeah,
was the
the
one
name.
that
Yeah.
sure.
All right. Thank you very much, Emmanuel. So I just choose these three musculoskeletal disease and disorder to discuss, but we have a lot of them. Okay, we have a lot of them: systemic lupus and tomatosis. Tomatosis. So we have a lot of them. Okay, but we don't know that this particular disease are musculoskeletal disease. So I've learned about some of them which I did not know. I didn't even know their names. I just learned in the process of, my school this thing. So I'm very,
Study.
very happy you were able to join me today to talk about musculoskeletal disease and disorder. Me myself, I've learned a lot, and I believe you've also learned something from it.
Sure, I've learned. So it's a good one. So I should be one thanking you for the insight you've given so far.
All right,
Something. Yeah.
thank you so much.
Thank
And
you. Yeah.
I would love the both of us to, the two meeting I've held with you. The other one I talked about, I think skin disease, and this one is
Yeah.
musculoskeletal disease. I want you to, like, don't just think that I'm the one schooling. I'm just using you to do my practicals. No, I want you to, continue practice what you've learned. Okay, like me, if I go out, I saw somebody with maybe body illness or some diseases that have been taught, I will be able to, point out, say
Identify
this.
them. Huh?
Yes, I'll be able to find that this is so disease. This is so disease. This will help us, and this will also help people around you. Thank you very much for giving me your time. I really
Thank
appreciate.
you. All right. You're
All right, hope
welcome.
to see you next week.
All right, sister, bless you.
All right, thank you.